Welcome to Applying for Health Insurance. We will go over the basics of how to apply for health insurance and the overall process. This video was brought to you by the Wellbeing and Health Promotion Department at San Diego State University. Before diving into the health insurance process, let's address compliance. ACA stands for the Affordable Care Act, which was a comprehensive reform law passed in 2010 that increases health insurance coverage for the uninsured and implements reforms to the health insurance marketplace. Some of those reforms include no one can be turned down for coverage, no one can be denied for having a pre-existing condition such as diabetes, cancer, and asthma. Health insurance rates are not based on health status. Health insurance companies have to offer comprehensive plans, meaning their plans must cover the 10 essential health benefits, including hospitalization, ambulatory services, emergency services, maternity and newborn care, mental health and substance use treatment, prescription drugs, including name brands and specialty medications, lab work, preventative care, pediatric, dental, and vision, rehabilitation services. Additionally, a choice of affordable plans must be made available. In the U.S., it is required that all health insurance plans are ACA compliant, meaning they have to abide by all the reforms that were just mentioned. In California, there are two main types of health insurance plans that you can apply for depending on your monthly income. There's a whole chart of household sizes and incomes that you can look up on the Medi-Cal's website. But for the purpose of this video, we will be using the one-person household income, which is $1,676 per month. If you make that amount or less, you would qualify for Medi-Cal, California's version of the National Medicare program. Once you qualify for Medi-Cal, you will be given the option to select a low-cost plan under the umbrella of Medi-Cal. Currently, there are 4 plans you can select from in California: Blue Shield Promise Health Plan, Community Health Group, Kaiser Permanente, and Molina Healthcare of California. If you make more than the $1,676 per month, you would not qualify for Medi-Cal, but you can select a health plan offered through Covered California. Covered California is California's open health insurance marketplace. Covered California functions like Amazon, where you input your filters. In this case, those filters would be your age, household zip code, benefits you need or want, and dependents. And then based on what you selected, you are given a list of health plans you can choose from. The cost of each of these plans are dependent on your filters. An important thing to note when applying for healthcare insurance is that you can qualify even if you are a dependent from out of state and or regardless of your citizenship status. Prepare to apply. Before you start the application process, there are a couple of important things and information that you need to gather. One of the first things you'll be asked to provide is proof of identity. You can do this by submitting your driver's license, passport, military ID, or birth certificate. The next thing you'll be asked about are your citizenship status and Social Security. Typically, you can satisfy both of these by submitting your Social Security number, as you would only have one if you're a U.S. citizen. If this is not the case, you should have documents from social services that state your citizenship status, and you could submit these documents instead. You will also need to gather documents to prove your income. These could be your pay stub, last year's tax return form, letter of employment from your HR department, or salary appointment letter. Household size is pretty self-explanatory. It is simply the number of people who live in your household. The only thing to keep in mind is do not include roommates or those that live with you that are not related to you, since you are not looking to add them to your health insurance plan. Lastly, the application will ask you about your past and current medical history. It is important to be as accurate and honest during this portion of the process, as it can affect what plans are offered to you. You can reference your medical history from your past providers to help you gather your health history. Now, onto the application itself. Luckily, California has made it very easy for you to apply for health insurance. You use the exact same application regardless of whether you're applying for Medi-Cal or Covered California. There are 3 ways you can submit the application. The first being online via coveredcalifornia.com/apply, pictured on the right of this slide. The second way is through a certified enrollment counselor. For SDSU students, you have the option to meet with a certified enrollment counselor on Tuesdays and Thursdays from 9 a.m. to 3 p.m. in the Basic Needs Center, located on the 3rd floor of the Calpulli Center. They are a free service available to students and can assist you with the entire application from start to finish. So I highly recommend attending one of their walk-in sessions. If you're not a student or don't have the time to make those walk-in hours, you can still get help from an enrollment counselor by selecting Apply with a Certified Enroller option on the Covered California website. The website will then give you a list of locations and contact information for enrollers based on your location. The last method of applying is via phone. This is the exact same process as talking with a certified enrollment counselor, except your conversation and application will be discussed over the phone. If you would like to use this method, simply call 1-800-300-1506 or click on the Apply by Phone option and fill out the form for an enroller to call you. That concludes the basics of applying for health insurance. Thank you for watching. For further information or questions, please reach out to the Health Literacy and Outreach Coordinator within the Wellbeing and Health Promotion Department. Their contact information is listed here. Thank you.